So, Dr. Subramanian, you are a medical oncologist and you're basically a experience with all cancers, but you are a specialist in breast cancer. So, the first topic that you could tell us about is what's new in breast cancer prevention.
That's right. Thank you, Dr. Vicario. First of all, a few facts about breast cancer. It's a very common disease. About 1 in 8 women in the United States are at risk of developing breast cancer. Thankfully, the rate of dying from it is a lot like 1 in 28. So the odds are fairly good when you get breast cancer. It's second in being a cause of cancer-related death in women, second only to lung cancer. About 200,000 women a year contract breast cancer or are diagnosed with breast cancer. But at any given time, there are about 2 to 2.5 million survivors of breast cancer in the United States. A lot of focus has been on how to prevent this very common and sometimes life-threatening disease. One of the focus of treatment in prevention has been really to look at certain drugs like tamoxifen or Evista or raloxifene as targets for preventing breast cancer. There have been large studies that have looked at tamoxifen, and there's been a similar trial that has looked at tamoxifen versus raloxifene and found similar results in preventing breast cancer, a very common variety of breast cancer called the hormone-positive breast cancer. Then there are also trials that have looked at identifying populations that may be at higher risk. This has to do with a gene called the breast cancer gene. It's been described originally in the Ashkenazi Jews, but we've come to realize that minorities and other populations also have a fairly high incidence of having this gene. There is a commercially available test for this gene. If we have time, we can go into the people who are at risk. Just in thinking in terms of layman terms, anybody with a family history of breast cancer, having a member of the family with both breast and ovarian cancer, having a personal history of breast cancer before the age of 50, certainly belonging to a high incidence population like Ashkenazi Jew. These would be cases where breast cancer gene testing should be offered. In these situations, sometimes taking out the ovary has resulted in dramatic risk reduction from getting breast cancer. I could go on, but we'll move on to the next part of our talk on breast cancer.
Well, thank you very much.